We have done a lot of coverage, a lot of analysis on hantavirus, but I know there's still a lot of concern. So let's bring in an infectious disease specialist. Dr. Srinivas Murthy is a specialist and a clinical associate professor in pediatrics at the University of British Columbia. Thank you very much for coming in. Let me start with a basic question. How concerned should we be when you consider that at a hospital here in British Columbia, there's a patient with this Andes strain of hantavirus?
Yeah, like my first and foremost concern is on the patient with Andes virus. We know it's a severe infection and it does have a reasonably high case fatality rate. So our concern is on those patients. The broader public, I think less so for now. We know a lot about the transmissibility of Andes virus. And the thing about this cruise ship outbreak is that we know every single person who has been exposed. And so if we do good public health measures, follow, quarantine, isolate, track, we should be able to keep track of these things. So the next few days are crucial.
You're being careful, as you should be, using words like, we should be okay, that the risk is low. And I don't want to have you say anything that you don't feel as a specialist in infectious diseases is not accurate. I want you to be as accurate as possible. But let me throw something out to you and you can respond. Feels to me like if all of the people from Canada who are on that cruise ship are isolated and being cared for very closely, that the risk of transmission from them to the wider population is virtually nil. Is that a fair statement?
That is the hope. Virtually nil is something we in epidemiology don't like saying because anything is possible. Yeah. But if good public health precautions are in place, those healthcare workers who are caring for that patient use good precautions and good ventilation throughout, we should be okay.
Now, let's look at it from the other side. The last time you and I spoke, it was during COVID-19. And, when I see Dr. Bogosh, when I see so many of the infectious disease docs, this is the familiar cast that's showing up again. And so there are people, and I saw, comments online from people who seemed reasonable saying, this feels really bad to us. It feels like, are we on the verge of another pandemic? What would you say to that?
The scary thing about this virus is its severity. We do know a lot more about this virus compared to SARS-CoV-2. Our colleagues in South America have been managing this virus for decades. And so there's been lots of phone calls, lots of sharing of information with them about how to best control it, how to best treat it. And so we're starting not from zero, but we're starting a bit ahead of the game this time around.
And I guess we should underscore that this is not the strain of hantavirus that occasionally pops up in Canada in the prairies, for example, from rodents. This is something different, and it doesn't normally exist in Canada.
That's exactly correct. The clinical disease is similar, though. And so the clinical lessons that the teams from South America are teaching us have been useful. The transmissibility is the difference that we think.
One last thing I want to ask you about, entirely different disease, but also a health crisis that's unfolding in parts of Africa, Ebola. The risk, as I understand it, is not of it spreading to Canada, but it is a health emergency going on in Africa. From your perspective, what should we know about it?
Yeah, the thing keeping me up at night is not hantavirus right now, but it's the Ebola outbreak. We know very little about how many are infected. There's likely a huge number of individuals walking around those communities who are infected, transmitting the disease. And we have very little management possibilities in terms of vaccines or therapeutics for that. And so I do have a great deal of concern about that outbreak progressing quickly. That's why the WHO was very quick to declare this public health emergency of international concern.
And so, for compassionate Canadians, what should we know about what's happening in Africa?
I think first and foremost, this is sort of in a part of the world where they have a lot of experience managing this, but they don't have the resources necessary. Like after U.S. aid cuts over the past numbers of years, the ability to detect and respond to these viruses has gone down, and that puts us all at risk.
Okay, well, Dr. Murthy, maybe I don't enjoy the circumstances, but thank you very much for speaking. It's really nice to talk to you again.
Take care.